If you've been getting kind of bored with reviewing some of the more mundane psychological topics that we've covered up to this point, well, this video is for you. I'm Sarah Tippett, and welcome to this MCAT Science Review video on consciousness-altering drugs. We'll dive into the four main categories of consciousness-altering drugs, including depressants like alcohol, stimulants like cocaine, opiates like Vicodin, and hallucinogens like LSD. We'll also cover marijuana, though it gets its own category because it's a little bit strange. And finally, we'll wrap things up with drug addiction. Our goal for this session is to be able to describe the effects of common consciousness-altering drugs in order to answer questions on the MCAT dealing with topics such as GABA activity in the brain. Our first category of recreational drugs is depressants. As their name suggests, depressants reduce nervous system activity. The main pathway to accomplish this is by increasing the activity of the GABA receptor. GABA, or gamma-aminobutyric acid, is a neurotransmitter that results in generalized brain inhibition. By binding to the GABA-A receptor, chloride channels open, allowing chloride ions to enter the cell, which hyperpolarizes the neuron. Depressants can either promote more release of GABA or mimic GABA itself.
Let's move on to an overview of common drugs in this class. Alcohol and anti-anxiety medications like barbiturates and benzodiazepines are some of the most commonly abused depressants. As stated on the previous slide, both of these drugs increase GABA activity, resulting in their desired effects. I assume most of you know that alcohol reduces inhibitions and has a mild euphoric effect, resulting in decisions like belting out "girls just want to have fun" at your local karaoke night. Other effects include decreased logical reasoning and impaired motor skills. More serious effects of alcohol abuse include cirrhosis and Wernicke-Korsakoff syndrome, which is characterized by memory impairment and mental status changes. Barbiturates like phenobarbital have been largely replaced by benzodiazepines like Xanax and Valium. These prescription anxiety medications can be highly addictive, so care must be taken when prescribing them. If combined with alcohol, abuse can even result in death due to additive depressant effects of these drugs.
Let's switch gears and talk about some uppers, or stimulants. Amphetamines, MDMA, which is a designer amphetamine called ecstasy, and cocaine are some of the most commonly abused stimulants. Stimulants increase arousal and the frequency of action potentials. Specifically, amphetamines increase the release of dopamine, norepinephrine, and serotonin, whereas cocaine decreases the reuptake of dopamine, allowing it to be active for a longer period of time. The effects on the patient include increased heart rate, blood pressure, euphoria, hypervigilance, and anxiety, as well as paranoia. Prolonged use can even result in stroke. If a patient uses these drugs for prolonged periods and then stops, they can expect to experience withdrawal symptoms such as irritability and depression. On a side note, we actually do use cocaine as a local anesthetic for surgeries in areas that are highly vascularized, such as the throat or the nose. Ecstasy is special in that it is a hallucinogen combined with an amphetamine, so you get all the effects of a stimulant along with an overwhelming sense of well-being and connectedness. Ecstasy, or E, is often a club or rave drug. Now that we've talked about uppers and downers, let's move on to opiates and opioids. Opiates are naturally occurring and include drugs such as morphine and codeine. Opioids are synthetic and include compounds like oxycodone, found in Oxycontin, hydrocodone, found in Vicodin, and heroin. These drugs, with the exception of heroin, are prescribed as common painkillers. Opioids work by binding to the opioid receptors in the body, resulting in decreased pain and increased sense of euphoria. Heroin was created as a substitute for morphine, but once injected is rapidly metabolized to morphine. You may come across methadone clinics in your studies of drug addiction. One of the ways we treat opioid and especially heroin addiction is by administering a long-acting opioid such as methadone to reduce cravings and lower the risk of abuse. Our last class of recreational drugs is hallucinogens. LSD, peyote, mescaline, and ketamine all fall under this category. These drugs work through a complex interaction between a variety of neurotransmitters, especially serotonin. Hallucinogens distort reality and enhance sensory experiences. Physiologically, LSD will increase heart rate, blood pressure, pupil dilation, and body temperature. LSD became popular in the 1960s, and its use was encouraged by people like Timothy Leary, who wanted people to turn on, tune in, and drop out. This wraps up our four major categories, but we still have one more drug to cover, and that's marijuana. Marijuana acts as a stimulant, depressant, and hallucinogen. The active ingredient is THC, which acts on the cannabinoid receptors, glycine receptors, and opioid receptors, causing an increase in GABA and dopamine activity. Effects include impaired short-term memory, increased appetite, and hallucinogenic effects, among others.
Now that we've gone over some major recreational drugs, let's shift our focus to drug addiction. Drug addiction is linked to the mesolimbic reward pathway in the brain involving the nucleus accumbens and ventral tegmental areas and the medial forebrain bundle. This pathway is involved in motivation and emotional responses, which acts as a positive reinforcement of substance abuse. This positive reinforcement results in dependence and addiction. This pathway is responsible for rewarding behaviors that have a survival benefit, such as consuming high-calorie foods. Drugs of abuse hijack this path since they trigger it but don't actually provide any survival benefit.
Now that we've reviewed drugs of abuse and addiction for the MCAT, let's tackle a couple questions similar to what you may see on test day. Here, the correct answer is C. Depressants work by increasing GABA activity, whereas opiates work through the opioid receptor. Take a look at this question. The correct answer is D. Stimulants can cause neurotransmitters to be around longer and in larger quantities. They do not impact calcium. Let's quickly run through the key points you'll need to know cold for test day. It's critical for you to understand how these drugs work in the body. So depressants and marijuana act by increasing GABA. Stimulants increase dopamine, norepinephrine, and serotonin activity. Finally, the mesolimbic pathway, which involves the nucleus accumbens, medial forebrain bundle, and ventral tegmental area, is responsible for drug addiction. Great job on getting through this video. You should now feel more comfortable when faced with MCAT-style questions dealing with consciousness-altering drugs. Keep up the great work!